Finally, I'm pleased to introduce Dr. Jackie Whittaker to you to speak about practical strategies that you can use to keep your knee healthy and prevent osteoarthritis if you have had an injury. Dr. Whittaker is an associate professor in the Department of Physical Therapy at the University of British Columbia and research scientist at Arthritis Research Canada in Vancouver. She has a Michael Smith Foundation for Health Research Scholar Award and Arthritis Society's STARS Career Development Award. As a recognized clinical specialist in rehabilitation, her research takes a lifespan approach to preventing osteoarthritis and is done in conjunction with patients, health professionals, and other stakeholders to make it more relevant to real-world settings. Please welcome Dr. Whittaker.
Thanks, Lisa, and thanks to the McCaig Institute for this wonderful opportunity. I will say I am not an outsider. I was born and raised in Alberta in a little town called Stettler. I have moved to the West Coast, but I do consider myself still an Albertan. So I'm really excited to be here to talk to you about a topic that's near and dear to my heart, which is knee health. And I suspect for most of us, our knee health isn't something that we think about very much. We don't really, we just take it for granted. Until, of course, something goes wrong and we realize just how important our knees are for doing the things that we have to do or that we need to do. So I'm just wondering, just by a show of hands, and for those of you online, I'm sorry I can't see you, but how many of you have had a knee injury that's interfered with your ability to work or do the things that you want to do? So for everyone online, there's a fair number of hands going up in the crowd, and that's not really surprising because we know knee injuries are incredibly common. They typically occur, believe it or not, between the ages of 15 and 35, and particularly when we're participating in sport and recreational activities. But that's not to say that they can't occur outside of that age range or in other settings. That's just where we see the bulk of them. It has actually been estimated that about 500,000 Canadian youth hurt their knee every year playing sports. And although we'd like to think that those injuries just heal themselves and go away, we know that about half of them will go on to develop osteoarthritis. So that's quite a large number of young people. Now, we've heard a little bit already this morning about osteoarthritis, but I just wanted to make sure we were all on the same page. Osteoarthritis is a degenerative joint disease, and it results in the deterioration of the cartilage, which is that tissue that covers the ends of our bones in our joints. And that can lead to swelling in the joint, pain in the joint, and weakness of the muscles around the joint, which ultimately makes it difficult for people that are living with osteoarthritis to do the things that they love to do. As we heard, I think it was Dr. Whirl said, there's a lot of joints that can be affected by osteoarthritis, but the one where we see the majority of the cases, 80% of the cases, is the knee. Now, it's incredibly important to stress that osteoarthritis is a disease. It is not a natural consequence of aging. Not everyone in this room is going to get it. And it's not just normal wear and tear of the joint. And the reason that it's important to understand that it's a disease process, is because just like, I don't know, diabetes or cardiovascular disease, once you know you're at increased risks, there's steps that you can take to reduce your risk. But if you think it's inevitable, you're unlikely to do that. And one of the main ways in which our risk for osteoarthritis goes up is when we have a joint injury or when we have a knee injury. And the sort of rotten thing about it is that once you've had a knee injury, the risk doesn't just go away spontaneously on its own. You actually have to live with it for the rest of your life, and you have to learn how to navigate that. Now, that's not necessarily bad news. It's just your new reality. The good news, the silver lining, if there is one, is that the earlier you know that you're at risk, the earlier you can do something about it. And figuring out what to do about it is what my team and myself have been working on for several years now. And what we've learned really is that if you want to reduce your risk for osteoarthritis, there's basically 4 things that you need to be doing. Monitoring your knee so you can act early, feeding your cartilage, building your muscles, and controlling your body weight. So let's start with monitoring your knee. I think we can all appreciate that if you have a knee injury, there's pain, and that pain can interfere with school, work, recreational activities, whatever it is that you're doing. Now, for some people, that pain's going to go away. For other people, it's going to go away, but then it's going to kind of come back. And for other people, it's never really going to go away, and they're going to kind of go down this road of this sort of decline in health, this spiral of health that you can see up on the screen. This spiral, this downward spiral in health is actually quite common, but we don't talk about it a lot. And that's really unfortunate because you can imagine that by the time you've gained weight and you've developed osteoarthritis, it's really hard to reverse things. But if you can act early, maybe when a flare-up hasn't resolved or when you first start to notice that your lifestyle is really changing and you're becoming less physically active, then there's ways that you can actually reduce that from happening. I can't tell you how many people that I have met over my career that went down this downward spiral of health because they just didn't ask for help early enough. I cannot stress strongly enough how important it is to seek help early when you notice that you're becoming inactive. Not wait, thinking, oh, I'll rest my knee, it'll settle itself down, and then I'll be active again, only to wake up a year or two later and realize that your lifestyle has dramatically changed and you're way less active than you used to be. I want to assure you that it is possible to exercise and be active after you've had a knee injury, even if you have flare-ups, and even if you go on to develop osteoarthritis. And in fact, that exercise is the first line of defense against osteoarthritis. And you might ask, well, why is exercise the first line of defense? And it's basically because it comes down to the thing that feeds your cartilage, builds your muscles, and help you control your body weight. So what do I mean by feed your cartilage? Well, remember we mentioned earlier that cartilage is the tissue where we think osteoarthritis starts. And cartilage is sort of a unique tissue. It doesn't have a great blood supply, so it can't get its food the way that most of the tissues in our bodies do. Instead, the way that it works is cartilage acts a little bit like a firm sponge. It's got a bunch of little holes or pores. And just like a sponge, when you squeeze it, you push the fluid out. And the fluid in the joint is actually really important because that's where the food sits that the cartilage needs. So you squish the cartilage, any fluid from the joint that was in it goes out into the joint capsule. And then when you release that squishing, the fluid can come back into the cartilage. So you squeeze, the fluid goes out, you release, the fluid comes back in, bringing with it the food that the cartilage needs to stay healthy. So how do you think we naturally squeeze and unsqueeze our cartilage or compress and uncompress our cartilage to pump that fluid in and out? Pretty safe guess, it's exercise. But it's not just any exercises, it's special exercises. And we call these cyclical weight-bearing exercises, which in all honesty is just a really fancy way to say exercises where we cycle between squishing and unsquishing the cartilage. So loading and unloading the cartilage, compressing it or decompressing the cartilage. Examples of cyclical weight-bearing exercises, they're not fancy. It's walking, it's running, it's jumping, it's climbing stairs, it's squatting. If we don't do these things on a regular basis, our cartilage gets hungry, it gets weak, and it starts to break down. But if we can do a little bit of these exercises every day, we can feed our cartilage and we can give it a fighting chance. Now, I know that that might seem contrary to something you've heard before. A lot of people, including a lot of healthcare practitioners, believe that impact activities and weight-bearing activities aren't good for our joints or for our knees. But what we all need to realize is that cartilage has one job. The reason it is in our joints is to deal with load. It is built to deal with load. And when we take that job away, it becomes weak and it starts to break down. Now, that doesn't mean that after you leave here today, you're going to go home and you're just going to start doing a ton of impact activities. You've got to slowly build your capacity up over a period of time, and you ultimately have to figure out what works best for you. The main message is to know that they're important activities, and if you don't know where to start or you get stuck, you need to reach out to somebody who can help you, and that's likely going to be a healthcare professional that specializes in exercise, like a physiotherapist. Okay, so what about building our muscles? The most important muscles for helping to reduce our risk for knee osteoarthritis are our thigh muscles, so our quadriceps and our hamstrings, our calf muscles, and our glutes or our butt muscles. And so how do we build muscles? Well, again, it's not a surprise, it's through exercise. But just like medication, if you want exercise to work, then you need an adequate dose. One that's going to be sufficient to stimulate the muscle to grow, to change, to adapt. And that means we have to think about the amount of exercise, how frequently we do it, and for how long or the duration of the exercise. So we have to think about the dose of the exercise. And you might be asking yourself, well, how do I know if I have the right dose? Like, what's the right dose? And the challenging thing is that the right dose is individual. It's not the same for everybody. It's individual. And it takes a little bit of trial and error to figure it out for yourself. And ultimately, it depends on where you're starting from, where you'd like to go. And it's always going to be a balance between these two things, effort and pain. First and foremost, if you don't have enough effort, if there isn't a big enough dose, the muscle will not be stimulated to grow, and you're wasting your time. And one of the biggest mistakes that people make with their exercise is they underdose because they're scared. It's okay. It's not like you're doing it on purpose. There's a few things that you can sort of consider if you want to know, did I do enough? Did I have an adequate dose? The simplest thing is that your muscles should feel fatigued and you should feel shaky after you've exercised. And you probably should have a little bit of second-day soreness, although that might change over time. If you want to get a little bit fancier, you can think about, well, how hard was the exercise on a scale from 1 to 10, and aim for sort of a 7, 8, or 9. And if you're doing an exercise that's a certain number of sets and reps, like 3 sets of 10, when you're done those exercises, you should only have 1 to 3 reps left in the tank before you would be fully fatigued. And if you're not going that far, you're probably not getting enough exercise. Now, the question, though, is how do you balance that with pain, right? How do you do that without increasing pain or having pain? And in all honesty, you might not be able to. But actually, research has shown that it is okay to exercise with pain, as long as that pain is a 5 out of 10 or less. And if it goes up during or after exercise, it comes back to pre-exercise levels within 24 hours. And in fact, if you do exercise with pain and follow those 2 rules, what you will find is over time, your knee pain will decrease. In fact, exercise is one of the most potent painkillers for knee pain, and that's been shown over and over in the research. More effective than education or Tylenol or Advil or ibuprofen or anything else that's up on that screen. I know it seems a little counterintuitive, but there's really good evidence to support that. But again, it doesn't mean that, after today you're going to go home and you're just going to start going crazy with your exercises. You've got to respect where you are, and you gradually have to build up your capacity to do strengthening exercises to build your muscles over time. The big thing is that if you don't know where to start or you're getting stuck, don't give up, don't give in, go out and seek some help. Okay, the last important thing that you need to do to try to reduce your risk for knee osteoarthritis is to control your body weight. And the reason for that is that just like a joint injury, obesity is a very well-established risk factor for osteoarthritis. So if you have a knee injury and you gain a bunch of weight, your risk for osteoarthritis is greater than if you just had the knee injury. I think we can all agree that losing weight is a challenge at the best of times, so it makes a lot more sense to try to prevent the weight gain than lose it. But either way, the best way to control your weight, nobody's going to be shocked by this, is a combination of physical activity and diet. Every country has its own physical activity guidelines, and we've already had ours shared with us a little bit today. In Canada, basically adults should be getting at least 150 minutes, a minimum of 150 minutes of moderate to vigorous physical activity every week. And just so that we're all on the same page, moderate to vigorous means you're sweating when you're doing it. And if you're younger, that should be about 60 minutes a day for up to about 420 minutes per week. As far as diet, again, we can look to the Canadian Dietary Guidelines, which recommend that we eat a variety of healthy foods. Half of our diet should be vegetables and fruits, 25% whole grains, and maybe it'll have some of that dietary fiber that Dr. Reimer was speaking to us about, 25% lean proteins, and our choice of drink should be water over fruity drinks and sugary drinks. Guidelines also encourage us to be mindful of our eating, to try to eat at home a bit more, and to try to limit our intake of those highly processed foods that have a lot of sodium and sugar and saturated fats in them, just as we've heard earlier. So these 4 strategies, simple strategies, can go a long way to improving the health of your knee and reducing your risk for knee osteoarthritis. By monitoring your knee, you can act early at the first signs, particularly the first signs of becoming physically inactive. By doing a little bit of cyclical weight-bearing activity, you can give your cartilage a fighting chance. By doing exercises that build your muscles and physical activity, as well as being mindful of your diet, you can create a healthy environment for your knee. So I'm going to leave you with a couple last few points. If you've had a knee injury, I would encourage you to remember that osteoarthritis is not inevitable, and that the earlier in life you do something about it, the better, as opposed to waiting. Remember to reach out for help early, particularly at the first signs that you think your lifestyle is changing and you're becoming less physically active, so that you can avoid that downward spiral in health. Try to increase your capacity for weight-bearing activities so you can feed your cartilage and keep it healthy. Remember, it's okay to exercise when you have some pain, as long as it's less than a 5 out of 10 and it goes back to pre-exercise levels within 24 hours. And then finally, remember that it's harder to lose weight than it is to prevent the weight gain, and be mindful about the amount of moderate to vigorous physical activity you're getting, as well as your diet. So I'm going to leave you with that, and I think we get some questions now.